Welcome sa Module 1, training ng AHIN. This is an initiative we started last year. Dr. Alvin Marcelo asked me to help the team deliver this workshop. Initially, it was delivered sa UP, and there were the module was improved after that, after some feedback regarding concepts that are not easy to understand for the trainees. One of the concepts that were difficult to understand was health systems and health financing, because yung openIMIS, it integrates electronic medical records and health financing concepts. And of course, yung openIMIS in itself was able to, the students were able to understand it, pero yung connection niya sa health financing medyo hindi na-cover. So that's the reason why I'm helping the team deliver this module by providing an introduction to health systems. And dagdag na rin dyan yung how to integrate health financing sa openIMIS. I mean, how we can make sense of openIMIS in light of our current processes, especially in the Philippines. So when we started this training last year, I didn't know yet what openIMIS was. I just know that it's a tool that can help health systems improve or increase accuracy of information, health information exchange. The current systems that we have in the Philippines, most hospitals, for example, have electronic medical records, especially in the metro area, but in the far-flung areas, it's still a mix of electronic and pen and paper. We also have systems that can provide transaction interface between health providers and payers, such as private insurance systems or public insurance systems such as PhilHealth. The problem is each of these institutions will have their own system, and the lack of a system that is able to talk in between these institutions adds to the already existing inefficiencies. So openIMIS is one of the tools that has been developed over the past decade on how to make systems, electronic systems like this, crosstalk to increase efficiency. Now, this training is aimed towards medical students who will become future health workers. In addition to what you already have or have learned from your respective schools regarding health systems, I aim to supplement that with this lecture. But of course, this entire lecture is just an overview of what it should be. It usually is composed of several modules, but I'm compressing it into one lecture for less than like 40 minutes. So what we did was to pick up some of the most important concepts we think that are useful for a learner of the openIMIS to be able to appreciate what openIMIS is for and how it can be useful to current or future healthcare practice. Okay, I'll jump into the lecture now. These objectives are somewhat straightforward. So maybe you may have read this several times before, but it's worth repeating. Health system can be defined in many ways, but we can always choose a definition that's understandable, acceptable to members of member states of WHO. According to the definition, health system is all the organizations, institutions, resources, and people whose primary purpose is to improve health. So this includes all spectrum of interventions to improve health, from promotive, preventive, curative, rehabilitative. When we talk of systems, generally in systems theory, one simple way of interpreting health systems is through identifying which are the elements of systems. We can use this definition and identify the elements of health systems in the following way. When you talk of systems, we can simplify or structure it in such a way that there's input, there are processes, and there's output. In health systems, in the definition of health systems, we can say that the input is all the organizations, institutions, resources, and people. The processes are all health system processes. It's not explicitly mentioned in the definition, but we can agree that all the health system processes are the ones that make sure that the output is achieved. So the output here is improvement of health. So that's a simplistic way of looking at health systems. There is another elegant way of framing the health system, and this was developed over at least 2 decades, I think, by WHO. They call it a WHO Health System Strengthening Framework. Now, you may also have seen this before, read this before, studied this before, but I just wanted to add my own thoughts about this and how a systems thinking can help us understand why this framework is existing. So in this framework, it's also more popularly known as 6 building blocks framework. So you have all the building blocks here on the left, and on the right are the final goals and outcomes of a health system. This 4, improved health, responsiveness, social and financial risk protection, improved efficiency. These are the 4 final goals that describe a strong health system. And the ones in the middle, access, coverage, quality, safety, these are the intermediate outcomes that we need to make sure we achieve before we can achieve the final or overall goals. So again, using the framework that we have seen before, we can divide all the 6 building blocks into input, processes, and output. So the core inputs of a health system are health financing, so the money, and human resources for health, the health workers. These are the inputs. Processes are made possible by leadership and governance and health information systems. So however much money you have, however much human resources for health you have, if you have poor governance and leadership, and if you have poor health information system, it may not lead to the output or the outcomes that you are aiming for. So we will discuss this in a little more detail in the following slides. Oh, I have to go back here. Some of you may have asked, why is the system of building blocks seemingly incomplete? Why is there not a building block for society and culture? Why is there not a building block of behaviors? So we have to go back on why this framework was devised in the first place. This framework was devised by WHO and the team that composed it for health systems to have something to work on, to act on. And these 6 building blocks are the ones that are practically actionable. Every government, for example, or member state can act on just 6 building blocks. They didn't put all the other elements that can be relevant in health systems, such as behavior and culture, because these are hardly actionable. You can't change a behavior or change a culture of a health system, because it's an entirely different goal of, and WHO will probably not dare to impinge on that or interfere in that. So at least these 6 are the ones that WHO can at least give guidance or provide a guidance for. Okay. If I talk too fast or silent, let me know. So tuloy tayo. Let's proceed. So we go on to deep dive on the 6 building blocks. We start with the health financing, and this is potentially the bulk of what I'm going to talk about. Simply put, health financing deals with mobilization, accumulation, and allocation of money. This is for health systems to be able to pay for the services that are needed by the population or the community. The purpose of health financing and its instruments is to make funding available, as well as to make sure that the providers are content and happy and well compensated. In addition to ensuring that all individuals that belong to the health system have access to services. When we talk of health financing, we can further dive deeper by asking some of these questions. What are the core functions of health financing? We can answer that in the following slide. Oops. Okay, let's. There are 4 core functions of health financing. First, you have to generate revenue. You need to generate revenue because you need to pay for the services provided by the health providers. Next, you also have to pool risk. It's called risk pooling. It's also similar to saying risk dilution. The more members you have, the more equally, the more distributed the risks and costs are. So as many members of the population as you can, try to enroll them, because it means that the cost can be divided to a vast number. So the cost will be lower, and that's beneficial to the system. The third and fourth are highly linked. These are strategic purchasing and benefit development. So you need to be able to make for example, making case rates. Case rates set the amount of or the cost needed to pay for a specific service, for example. And I think it's better to show this next slide to situate ourselves. What are the core functions of health financing? So you may have also seen this before. The health finance is called the health financing cube. So this cube has 3 axes: population coverage, service coverage, and financial protection or financial coverage. All health systems have some level of coverage mechanisms. This is represented by the smaller cube inside the big cube. Of course, all health systems will have different dimensions of this small cube, but the goal, every health system's goal, is to reach the edge of the bigger cube. Currently, no health system can say that they have reached the biggest, the perfect cube. All health systems will have some level of deficiency in any one of the at least one of these axes. And then what the health financing functions are they make all these edges of the current coverage mechanism be extended in all the three axes. So revenue generation and risk pooling ensures that the non-covered are slowly or even fast, even more fast, they get covered. Our current UHC or UHC law, for example, automatically enrolls all Filipinos to the public health insurance system, which is PhilHealth. Some other countries will have a different way of extending this coverage. I think, for example, in Thailand, they have at least 2 coverage mechanisms. For anyone who's from Thailand, you may be more familiar with this. Some other countries have other coverage mechanisms. So that's how risk generation and revenue generation and risk pooling helps towards the achievement of the bigger edge, the farthest edge of the cube. The 2 other functions, strategic purchasing and benefit development, work towards extending the service coverage and financial coverage. And we can see that in our own health systems. There are many ways that we can identify which one is strategic purchasing, which one is benefit development. Of course, for a very relatable example is benefit development is the case rates. The insurer can make various benefit packages that can help the health system achieve its UHC goals. Strategic purchasing, when you can make concessions with your either with the government or with the health care providers or both, in such a way that you are more efficient in your financial transactions, then it's also strategic purchasing. Okay, so the next question that you may be interested in asking is knowing who are the payers of healthcare. It depends. The answer is it depends on which country or which health system we are talking about. In a country like UK, the payer of healthcare is almost entirely government. In Philippines, the division is roughly this pie chart here. In other countries, you will have a different kind of distribution. It's important to understand that health financing and health insurance are not the same. Health financing is a much bigger entity than health insurance. Health insurance is just one of the health financing instruments. So when I say instruments, these include, in Philippines at least, we have health insurance, public health insurance, which is PhilHealth. We have government schemes and compulsory health financing schemes. So we have DOH and that's government schemes, and other compulsory contributory health financing schemes that also can be part of it. A small proportion can go to, at least in the Philippines, a smaller proportion of health financing is through voluntary health care payment schemes. So these are the private health insurance that we have in Philippines. Now, This kind of chart tells us that one of the biggest contributor or payer of our healthcare in the Philippines as a country, not individually, is out-of-pocket payment, 53.9. This metric shows us that we, as a health system in the Philippines, have a bad situation in terms of health financing. Why? Because if you have 53.9% of all the healthcare expenditures are paid out of pocket, this implies that many of the population who cannot afford medical treatment do not go to health facilities to get treated. That is bad because you will have bad outcomes. Sure, you can the government schemes and the voluntary private schemes can pay for some of the population, but a huge proportion of your population is not being taken care of by health facilities. Now, the goal is, at least in our setting in the Philippines, the goal is for let me put a pointer. The goal is for this government scheme to take up a bigger proportion of the pie, or essentially at least to minimize as much as we can out-of-pocket payment. We can never fully eliminate this, but the goal is not make it this big. The problem is, sure, we have instruments or strategies to reduce this, but we also need other form of help so we can achieve this. Monitoring this takes decades, and if you were to monitor this effectively, you need efficient monitoring tools. If you do not have that, then you may be aiming blankly at somewhere without knowing where you're going. So this is 2018. We don't, if we don't have efficient monitoring, we may have another outrageous number, or we may not be actually collecting the right data. What if we are already somewhat 40%, but the problem is we have inefficient and inaccurate information to begin with? That's where openIMIS can help us not just make systems more efficient, but make this health system realize its goals of reducing this household out-of-pocket payment. So this is it's a very good starting point, I think. At least that we can now say that for us to be able to achieve our health financing goals, we need proper, accurate, timely, and relevant information, because all the processes and strategies of the government and the entire health system as a whole will rely on accurate, timely, and reliable health information. This is where openIMIS can come in. So that's an overview of what health financing and health insurance is. We now go to the second input. We need health workforce for us to be able to deliver services. The definition of health workforce by WHO is people whose actions intend to improve health. So this includes everyone from all the range and of healthcare workers. It can include clinical, laboratory, administrative staff, volunteers. These are all health workforce. Effective health workforce not only requires the clinical or laboratory or administrative skills, but because health workforce are the workers that interact or interface with the clients, the patients, and they are usually the ones who input data in their respective record systems or databases. Administrative skills are also useful in this if you are to make our health information systems more useful, reliable, accurate. So those are the two health system inputs. We now go to the core processes that make the inputs usable. So leadership and governance, it has been recognized that this is central to all the building blocks. All the other building blocks will not move if leadership and governance is not moving. So this includes strategies, policies, laws, for example, frameworks, management systems, oversight, and partnership regulation. So if we, for example, again, going back to the Universal Health Coverage Law in Philippines, we have that law includes strategies, policies, frameworks. It also introduces change in management systems, change in oversight, change in financial systems for us to be more effective and efficient in our processes that help us achieve better health outcomes. For leaders and managers to be more effective in what they do or be more effective, we need evidence and information. That's where health information systems is. Health information is the basis of effective decision making, either in direct patient care or in hospital management, or in the entire sector. The reason why we have changes or new policies is that we rely on previous information and even projected information so that we can be more we can be more ready when we deal with future challenges in healthcare. Again, I mentioned this before, for information to be useful, it has to be accurate, has to be timely, relevant, and meaningful to decision makers. All of these four descriptors of information can be improved by using an efficient system, and openIMIS is one of the tools that we can use to achieve that. I will not dig deeper into this building block. I think the next module will be discussed by Sir Art. So I will leave this area for now. And we go now to the two other remaining building blocks. So these two building blocks, access to medicines and service delivery, these are the intermediate or immediate and intermediate output of all that of the input and the processes that went through. These are the immediately measurable factors, and we can say or assess health system effectiveness through these outputs as well. We can also say that these are the hallmarks of a functional health systems. If you can provide medicines and services, then it's a sign that you have a functional health system. This is also probably the reason why, if you have encountered this before, there are metrics such as maternal mortality rate, infant mortality rate. Although it's a very focused metric, not because it's focused, because it's not all people are mothers, not all people are infants. But why use maternal mortality rate and infant mortality rate to assess health systems overall? This is a very sensitive metric because when you have maternal mortality, it tells you something not just about the status of mothers, but also the status of health systems overall. You have for you to be able to deliver effectively or assist mothers in delivering babies safely, you have to have all 6 building blocks in check or properly they achieve all their intended goals. So this is the reason why these 2 building blocks, access to medicines and technologies and vaccines, as well as service delivery, are the our core building blocks by which we can act on. I mean, health systems can act on. Okay, so as a recap, so these are the 6 building blocks. We have input, we have money or financing, and then health, human resources. The overarching processes are leadership and governance and health information systems. Overarching because they touch, all of these 2 touches on the other building blocks more encompassingly. The final building blocks are outputs of health systems, which are medicines and technologies and vaccines, as well as service delivery. So I hope that's a good introduction for you to be able to at least refresh your minds regarding what health systems is, what health financing is. Before I end this lecture and before I entertain questions, I want to give this schematic, sample schematic. This is at least case in the Philippines. But I think this is something that you can relate to even not in the Philippines, but to other countries. So this is financing flow of Philippine health system. This has been changed, of course, in the recent years, but generally this financing flow still holds. The arrows are financial transactions. So this is a simply oversimplified version of what happens with money in our health system. I want you to focus on this specific section of the flow. PhilHealth is the public health insurance, social health insurance system of the Philippines. It pays insurance payments to healthcare providers if they provide service. The trigger for PhilHealth to pay these insurance payments are premiums. They will have to check first, is the patient a member of PhilHealth? That's one. Second, is the patient, has the patient paid her or his premium? That's 2. And finally, has the health provider provided the appropriate service, and is the provider claiming for an appropriate claim? All these checkboxes that need to be complied with before insurance payments are given take a lot of time to verify, especially if they are pen and paper, and also especially if the systems that make these checkboxes are not linked. So you have this broken arrow with this information. This is information required by PhilHealth to be provided by health providers before they give the insurance payments. What openIMIS can do is, let me just put my pointer. What openIMIS can do is to make this information exchange from health provider to PhilHealth and back more seamless. It doesn't take pen and paper. It doesn't take several minutes or days or months even. It can take within seconds. It's essentially the speed of electronic transmission. We can zoom in to this in a specific case use. Again, it's just a similar figure, but I want to show that within the interface of PhilHealth, pointer. Okay. Within the interface of PhilHealth and health facility, of course, you have the patient's here. This broken arrow from health facility to PhilHealth, if it's pen and paper or if it's traditional system, it can take weeks or months, or sometimes it may not even happen at all. But if we have a system such as openIMIS, which provides an additional layer of interface, this transaction can take much less than minutes. It can take literally a few seconds. And the goal is for us to appreciate that this is something that we can do and a health system can do. And also that's the reason why we are trying to spread this community of practice for our health system workers, especially the future health workers, to consider this as a viable option to improve our efficiency in terms of health information exchange.
Okay, good evening, everyone. So, first of all, thank you for inviting me here to give you an orientation on what we are actually preparing for the openIMS online program. So we have the openIMS online course, and what I will do is basically just present you how it will be delivered and what will be the expected outcomes. So really very short. So I will have at least the three major areas to discuss: Rationale, the intended learning outcomes, the course organization, and the delivery mode. But of course, that will be an online, or it could be in other mode depending on the schools that will be utilizing the program. So let's just give you a very short rationale. Of course, openIMS program can add more to this, or the member of the staff of the group can basically add more. See, Dr. Alvin can probably add more. We just would like to emphasize that health information system is an important building block of our healthcare system, and just been discussed a few minutes ago, that it is really an important element, especially in the current dispensation. It was discussed that, for example, even in healthcare financing, some records and encoding and decoding it probably would take months, and that would impact on the not only on the delivery but on the what do you call it, all the other elements, including payment schemes and availability of services or access. As I said, with the health information system, it provides a basis for effective decision making and is composed of data generation, compilation, analysis, synthesis, and use. So I need not cover that more because it was already presented, but just would like to emphasize that the health information tools can collect data from health and other relevant sectors, facilitate analysis of data, and help ensure overall quality, relevance, timeliness, and convert the data into information for health-related decision making. And in that context, openIMS is one of the tools by which health information can be generated, collected, compiled, and analysis of this data be done. So it can be used to inform an important health-related decision-making activity, payment of medical services, among others, and of course, segregate subnational data for better or for improved health management. So future students, our current students, who in the next few years will become future practitioners, are much more lucky than the doctors like we are. For example, we were never introduced to this kind of system. And even a lot of medical students before graduated medicine without even knowing the healthcare delivery system. And I hope that through this through this program, we go beyond knowing the system to even making sure that we are able to participate actively in improving the system through a very good information management system. So the course, therefore, based on that particular rationale, intends to make the student achieve the following. Students will gain deep understanding of the healthcare system and its components. Of course, if you are in whatever or from whatever country you belong, you may have a different way of running your healthcare system. But at the end of the day, that health system may follow the WHO guideline, for example, or framework for healthcare system. Another intended outcome would be for the students to be able to discuss the role of e-health in ensuring an efficient and sustainable healthcare delivery and financing system. So we are not just users, we will also be using the data to participate in the overall development process of improving our healthcare system. Not only our own system, like our personal clinics or our own telehealth or telemedicine services, but it's the whole system that we want to improve, and you will all be part of that in the near future, and for those who are already practicing in the current context. You should, as health professionals, you should be able to, or even as students now, and again as future health professionals, you should be able to utilize e-health, digital health, and digital health initiatives in all aspects of healthcare. As I mentioned, it's not just about healthcare financing. It's about your own decision making. It's about improving your healthcare decisions or treatment decisions, evidence-based decision making, especially for practice. And of course, it's important that you not only know about digital health or e-health initiative, but it's also important that you observe data privacy at both personal and professional level. It's raining hard, so maybe the sound may be affected. But, and also, we want you to become advocates of the use of openIMIS. It's not just you like them or you know that it will contribute, but we want you to be sharing the information and the skills that you learn in the online courses to others, so that you will be able to get a wider utilization. And you know that the more we utilize openIMIS, the more we utilize health information properly in our service, then the better will be the quality, or the more improvement we can implement. And to achieve that, or those objectives, we have divided the openIMIS online course into 4 parts. The first part will cover introduction to healthcare system. Part 2 will be e-health, digital health, and digital intervention. Part 3 will be privacy and ethical data processing. And part 4 will be the openIMIS, or learning the application. So let's just quickly go through the expected outcome for each of the parts. So for the introduction to healthcare system, we hope for the students to be able to, at the end of the module, to explain the WHO health system framework and its building blocks, and relate these building blocks to the Philippine healthcare system. Or if you're from another, this is only for for students of Philippine medical schools, but if you're in another country or from other countries, you can of course relate these building blocks to your own healthcare system, and then you should be able to discuss the role of e-health in the Philippine healthcare system, or in your own system. Part 2, we'll talk about e-health, digital health. It will be a long module, actually, about 4 parts. So here we talk about the differences or the definitions of e-health, digital health, and health intervention. We will also cover you should also be able to discuss the key components of the national e-health strategy. Currently in the Philippines, the discussion is still ongoing on policies that may be implemented or passed in Congress in relation to e-health and the bigger universal healthcare law. Also, you learn more about the importance of enterprise architecture. In the practice of health informatics, we will not make you programmers or software developers, but at least you're familiar with the architecture that you will be using and why these are the elements of the health informatics architecture. And give examples of digital intervention using the digital intervention guide of WHO. And it's also important for you to be able to differentiate open source and proprietary source solutions. Some of you may be using all those applications, but you're not probably familiar what they are all about. It's important that you deal with them and see the differences and advantages and disadvantages of those softwares. And we also, I think it is worth emphasizing that it's not just about technology, but also about the principles of human-centered design. We don't just make technology for the sake, or we don't just design technology for the sake of design, but for the sake of its, like say, its ability to maximize and also recognize the limitations and the level of what you call it, technology literacy of population that may be using the software. And at the end of the day, it's also about we not being controlled by technology, but rather technology enhancing our own participation in the healthcare delivery system. And we are students, or you are students and health professionals, can help very much, or can help in a lot of ways in improving our system by participating in the monitoring and evaluation of these platforms. So, for example, once you become familiar with the system, the openIMIS or the openIMS, you can actually do your own evaluation, send your feedback so that the software or the openIMS application that you're using will be improved further, because the more it improves, the better it will be for our healthcare delivery system. And of course, as I was saying earlier, it's not just about just also technology. But the thing with technology is the more you use technology, the more you may also be exposing people or people's data. All of you, as this will be discussed in the module, probably most of you, or maybe all of us actually, are using social media platform. At one point, we will be sharing some personal data. But are you sure how your data are being processed? Do you also know how data, earlier in the discussion, talk about healthcare financing and openIMS, and of course the need to collect data from patients. But do you also know how these data are being stored? How are they being accessed? And can we guarantee patients' privacy? Can we guarantee patients' confidentiality? As early as now, as medical students, we'd like to emphasize that one of our major responsibility is to ensure that patients' privacy are observed. And as you become doctors in the future, I hope that that kind of what do you call it, mindset the ethical mindset will be carried up to your professional life. And of course, the last will be the module on the openIMS. Now that you, after learning all the principles, the concepts, or the system that are basically will be benefiting from the openIMS, then the next or the last part will be for you to learn how exactly the openIMS will work. You will be simulating, you will be given an access to simulation programs or softwares where you can practice encoding or filling up elements of the form, and hopefully through that you will appreciate better how it works, and you will appreciate better how it can actually facilitate and make health service efficient, and hopefully also that will encourage you to become the best advocate or advocates for the use of openIMS. Uh, Not only in your own practice, but probably to advocate for its universal use, especially for those who have problems with developing or problems with financing their own software. This is the best that we can contribute to the system, not only to the Philippines but to the global community. So that's how we will run. For the moment, this will be online, but we will also be preparing both the faculty and student manual. The faculty manual is not a prescription, but it's just a guarantee that all of the schools will be at least standardized in its utilization of the training, because while we are giving schools the freedom to probably innovate and make it more appropriate to their own systems, we also would like to make sure that students are learning the same thing. So therefore, the standardization through faculty manual and standardization through the student manual. So that's how we intend to run the course, and hopefully this will be providing you with a better appreciation of the openIMS, and again, as I said, contribute to the whole improvement of the health information system. And again, for better healthcare, for efficient healthcare, and for monitoring and evaluation of better health outcomes. And again, for major to develop or to participate in a better decision making. That's all. Thank you.
Thank you, Dr. Nemuel, for helping our educators and students get an idea of what the succeeding parts of the module will be. And before we end, may we call on Ms. Christine Pascual?
Hi, everyone. Thank you for attending the first module of our openIMIS training program for medical students. So again, this activity is in partnership with the Advocates for Consciousness and Social Involvement Society and the Innovation Management and Business Association from the Ateneo Medical School for Public Health. So we would like to thank again Dr. Dante Salvador, all the way from Bern, for helping us understand the WHO Health Systems Framework, specifically how health financing works in the Philippines. And we'd also like to thank Dr. Nemuel Fajutagan, our health education specialist for this training program, for sharing with us the rationale and overview of this week-long training. So this is actually the first time that we are running this program virtually. So we would highly appreciate feedback from your end. Again, we are really thankful that many participants, not just from the Philippines, but also from other countries, are attending the session. And lastly, would like to take this time to invite everyone to our succeeding session. So tomorrow, Tuesday at 8 p.m., we will learn about health informatics from Mr. Art Ongkeko at 8 p.m. Manila time. On Wednesday, we'll be learning from Attorney Ivy Patdu for health data privacy. And finally, on Friday at 8 p.m. Manila time as well, we will be having our openIMIS hands-on workshop. So you will in this session, you will see how the concepts you've learned can interplay with an open source system for insurance management. So I hope you'll stick with us until Friday. Thanks again, everyone. Have a good night. Bye.